Hello everyone. Jai Mata Di.
Jai Mata Di.
Uh, so we are back with another lecture regarding the preparation of death reports, regarding the how to handle the brought dead cases, how to handle the cases of death at the various medical units. In previous lecture also we highlighted regarding the various fallacies, various uh, legally incorrect things that we were doing in the various death reports. And I'm happy that after that lecture, I have received some of the death reports, and there is a lot of improvement. But still, we need to improve more on the legal angle. We at IME, we as a team under the leadership and the guidance of Dr. Yashpal Sharma, Executive Director, SMVD IME, we have tried to prepare a simplified version of the legal guidelines or the standard operating procedures that we all need to follow at the medical units in handling the death cases, including both the brought death as well as the death that occurs during the treatment at the medical units. And more importantly, how to prepare that death report. We have prepared those guidelines. I think they might be in you in some days. So we will discuss that lecture. Screen share. So my screen is visible to you all.
Yes, sir.
Yes.
Thank you. So good morning, everyone. My name is I'm Dr. Jaspinder Pratap Singh, Assistant Professor and in charge of Department of Forensic Medicine and Toxicology at Shri Mata Vaishno Devi Institute of Medical Excellence. Next. So this lecture is regarding the duties of a medical officer in preparation of the death reports. I'm not going to comment regarding the treatment part. We are just concerned regarding the legal duties of the medical officer in and the preparation of the death report. So the objectives of this session will be the understanding what are the medico-legal cases, handling of the death cases, legal duties of doctors in case of deaths, and preparation of death reports. So what are medico-legal cases? I have deliberately added the slides of the medico-legal cases and their examples from the previous lecture also, because it is easy to read and understand what are medico-legal cases. But it is bit difficult to practically use that knowledge and marking the case as medico-legal, right? So we are bit sympathetic with the pilgrims at the medical units. So in that case, some of us are hesitant to mark the case as medico-legal. But this is very crucial from the legal point of view to mark the case as medico-legal case if the case is actually medico-legal, right? So that is very important part. So what are the medico-legal cases? Cases that need law enforcement involvement, death from accidents, suicides, homicides, any suspicious circumstances. deaths with medical procedure allegations. Every unnatural death is a medico-legal case. Anywhere, if the medical officer is suspecting that death is unnatural, that will be marked as a medico-legal case. So, of the medico-legal case. So these are the examples of medico-legal cases: suspected or evident homicides, suicides, even the attempted suicides, traffic collision accident, roadside accident, factory accident, any other unnatural mishap, suspected or evident poisoning. I request to mute yourself. Kindly mute yourself at your own level, because some voices are disturbing the lecture. So please mute yourself. Thank you. So other examples are the suspected or evident poisonings, even if it is accidental. Burn or electric injuries due to any cause, injury cases where foul play is suspected, including those caused by animals, injury cases where there is likelihood of death in near future, suspected or evident sexual offenses, suspected or evident criminal abortions, unconscious cases, especially where the cause of unconsciousness is not clear. Cases brought dead with improper history, which is one of the most common at medical units. Cases referred by court or otherwise, cases which require age certification, person under police or judicial custody, domestic violence cases, child abuse cases, or any alleged case of medical negligence. So another important concept is the institutional versus non-institutional deaths. Why this concept is important? Because if the death is institutional and it is a natural death, the one of the most important duty of the medical officer is to issue the death certificate. As per law, as per the guidelines of Government of India, the last attending physician must issue the death certificate if it is a natural death, right? So difference between institutional death means death during the treatment, while the broad dead cases are there were no signs of life when the patient was brought to the emergency and it is declared as broad dead. The broad dead cases are often MLC. Why? Because in that case, manner of death is not clear to the medical officer. Because merely on assumptions, without any proper evidence, without any medical documentation, we cannot comment on the manner. So manner is usually unclear in those cases in which we have to take the help of the investigating officer, or we can say the police, right? In broad dead cases. So what are the legal duties of the medical officers in death cases, right? So first is the reception of the case. Patient may be brought dead, may be a serious patient reported to the emergency. What we need to do? We need to give the patient the rapid assessment to the patient. We assess the vitals. We assess the any clinical symptoms, any clinical signs. And if there are no signs of life, we declare the patient as broad dead after the confirmation of that clinical criteria. I believe every one of you is competent enough. I'm not commenting on that treatment part or what is the clinical criteria. That I believe you all know, right? So you have a good amount of experience, you could have a good amount of knowledge regarding that, knowing that criteria or what assessment you have to do to declare the patient as dead, or what are the signs of life, right? We are more concerned about the legal duties here, right? And if the patient died during the treatment, that means the patient was alive when reported to the emergency. You tried the treatment, you tried to establish the diagnosis, you tried to give the best possible treatment using your skill, using your knowledge, and that patient died during the treatment in the emergency. That patient will be labeled as the death at the institution or death during the treatment. And in that case, document the time of death accurately, right? other is the documentation. Documentation is very, very important part. You have to document each and every minute to minute detail of the patient, or what you have done, what the patient was given, what you have assessed regarding the patient, what are the particulars, what is the time or arrival of the patient, what is the death time of death, right? We have to document each and every detail properly. We have to document each and every detail meticulously. So in if it is a broad dead case, clearly mark the case as broad dead, or if died during the treatment, mark death at the medical unit. Now record each and every detail, arrival time, death time. You need to document each and every detail, because in some cases we have to trace the relatives to because in previous death audit, the cause of death was not clear. At CSC Katra, they have issued the death certificate, but that was online and we could not retrieve that death certificate. So we have to call the patients, right? So in order to make that simple, make a simple move that you record each and every detail of the patient as well as the relatives, right? Relative detail important will be their RFID, Aadhaar number, or even the phone number, right? And next is the collection of any medical document or of past history or even the present history, right? They might be having some prescription slips in their phone. They might be having some medicine carrying along with them. So we need to document that, right? So this documentation is very, very important. So regarding the documentation of preliminary examination as well as the history, we need to give a thorough physical examination. More importantly in death cases, right? Because we don't know what is the manner of death, we don't know what is the cause of death, and this meticulous assessment, this will give so this will give the complete review of the case to establish the diagnosis regarding the cause of death, right? So examine the injuries in case anywhere over the body, and we need to record the terminal event. Terminal event can be gasping, and most of you, like, you are writing cardiopulmonary arrest. That is a terminal event. That is not a cause of death, right? So we can document that the terminal event was the cardiopulmonary arrest, cardiac arrest. We can document that, but that is not a cause of death, right? I think you must have understood now by now that terminology for that cardiac arrest or cardiopulmonary arrest is not cause of death. It is the terminal event. Terminal event of every death is nearly cardiopulmonary arrest only, right? So you can document it as a terminal event, but not cause of death. Fine. So we need to collect the detailed history, both present as well as past, from the relatives or from the witness or one who has brought the case to the emergency of the medical unit. And in case you can collect the document if they have any. In case they don't have any document for the past history, you can also document that no document was available in the phone or along with the relatives or the patient regarding the past history, but the past history as narrated by the relatives was this and this. That patient was a known case of hypertension, known case of diabetes mellitus, and whatever be the past history. Right? So next is initial death declaration and notification. In broad dead cases, we need to inform the police, right? And we will issue a preliminary death note that this was a broad dead patient, or this death occurred during the treatment. And this is a death note. You all are preparing the death note in form of that emergency slip, handwritten slip. That is a form of death note, right? So we need to mention there clearly that patient was broad dead or patient died during the treatment. And in broad dead cases, we need to inform the police, right? Because none of you, though doctors are called as gods, but we all know we are not gods, right? So we know that in broad dead cases, it is very difficult to establish the cause of death. And in the death report, cause of death is very, very important. So we need to take the circumstantial evidences, we need to take the manner of death into consideration, and doctor is not an investigating officer that who can establish the manner by sitting in his emergency or just assessing the patient in emergency without any evidence. So we need to involve police into it. So in broad dead cases, inform the police and do not mention any cause of death. You can mention the terminal event, but you must not mention the cause of death in broad dead cases till the receipt of complete police inquest report. Right? Now, from where this police inquest report will come to you? What you will do when you will hand over the body to the police, and in that case, in which cases you will hand over the body to the police? In broad dead cases, in any unexplained death, suspected unnatural cases. And in receiving, I have observed that to some extent the receiving was good, but the best receiving includes the rank of the police personnel, name of the police personnel, belt number, police station, along with his phone number. Right? These things are important. These things are necessary to in the receiving from the police personnel. His rank can be, he can be constable, he can be head constable, ASI, he can be SI, or even the inspector. Right? We need to mention the rank. Ask them to mention it themselves. Make it a habit to ask them that mention your rank, name, belt number, police station, as well as the phone number in the receiving. Right? That is the best way of documentation for the receiving from anyone. Right? So in that case, we need to direct the police for submission of police inquest report. Right? When you are handing over the body to police personnel, one thing we are doing there is we are referring the case for police inquest. Right? Why we are conducting the police inquest? Because we don't know the cause of death, we don't know the manner of death in broad dead cases. Right? So we are directing the police to get the police inquest done. We are directing the police to bring the or to submit the copy of police inquest report after it gets completed. Right? This will not be a simple process as we are just narrating it in a lecture that you have to say to the police to deposit or submit the copy of police inquest. At first, while we are implementing this, it will be difficult, but legally it is very important. You have to make sure that you receive the inquest report from the police on time. Right? We might have to send the continuous reminders to the police station. I have talked to the SHO Katra as well as the CSC Katra. I have done this type of homework by going there myself. But it is legally very important. Though you might be thinking that this is some hectic procedures, but the main issue was to legally safeguard you all. Right? All of you, nearly all of you were doing legally incorrect things. And to be legally correct, to save yourself first, is very, very important. Right? And in case you have referred the case to police for police inquest, do not issue any kind of death certificate or MCCD form till the receipt of inquest report. Right? So you might have understood till now, in broad dead cases, we need to inform the police, we need to direct the police to conduct the inquest report or the police inquest, and to submit the copy of police inquest report. Right? These things are very, very important. So next is the cause and manner of death. Right? आपके पास पेशेंट आया, पेशेंट ब्रॉड डेड था, पेशेंट डाइड ड्यूरिंग द ट्रीटमेंट था, उसके बाद आपने पुलिस इंफॉर्मेशन भेजी, उसके बाद आपने पुलिस को डायरेक्ट किया टू कंडक्ट द पुलिस इंक्वेस्ट. राइट? And also directed to submit the copy of inquest report. Now comes in your death report regarding the cause and manner of death. right? We need to avoid the vague terminology or non-specific terms such as in cause of death, such as cardiopulmonary arrest, brain edema, it seems to be, or it looked like a heart attack, right? We need not to mention these terms in cause of death. You can mention those terms like cardiopulmonary arrest. Like I have quoted the example that terminal event is cardiopulmonary arrest. You can quote the terminal event, but you cannot call it as a cause of death, right? So use specific terminology in writing the probable or even the exact cause of death, and that cause of death must be supported by the medical documents, must be based on any recent investigations or reports you have done at your medical unit before death, and mention the cause of death only when certain and defensible through the facts, right? Uh, in one of the report I was reading, that in which the medical officer has written that there is death due to the medical myocardial infarction, as there was height and due to hypoxia the patient might have undergone myocardial infarction. In that case, I would like to ask, there were no medical documents supporting that, right? What if the patient has stroke? There was no evidence to that, right? We can make n number of differential in that. So in establishing the cause of death, it must be supported by the medical documents, it must be supported by the investigations, right? And it must be certain. Now for uncertain cases, you are mentioning the exact cause of death cannot be ascertained after the inquest or postmortem, right? In case you cannot establish the cause of death, there is no shame in saying that we cannot establish the cause of death. We are not gods, right? So we can mention as that exact cause cannot be ascertained even after the inquest or the postmortem, right? In case the postmortem takes place, there will be cause of death. But like in 99% cases, the police forgoes the postmortem, right? So in that case, we need to ascertain the manner, and death of cause of death still remain uncertain, right? So because police cannot ascertain the cause of death, police will just mention it as that the manner was natural, so they forego the case on those grounds. So you mention the manner of death as natural, and exact cause cannot be ascertained even after the receipt of inquest or the police inquest report, in simple, right? So another important point in this legal documentation is the preservation of records. I think you all are doing this already. The all the medical record, any history sheets, examination or investigation record of the patient, any communication with the police, because now there will be communication with the police while you are referring the case for police inquest. We are handing over the body, and we are also directing them to submit the police inquest report to you, right? So there is that is important, because we have to make them understand that we need to complete our death report. That's why we need the police inquest report in that, right? All the identity documents of the patient as well as the relatives who has brought the case, any samples in case of poisoning or any infectious cases, or even any blood samples we have taken, right? Sorry. So other is the, now we have received the inquest report from the police, right? Now we need to incorporate those findings and conclusions from the police inquest report. It will clearly mention the manner of death. It can be natural, it can be accidental. Sorry. It can be natural, it can be accidental, it can be homicidal, suicidal, or can be undetermined, right? So the final death report which you will prepare, that must have exact clinical and legal cause of death, that must be having manner of death, and there must be consistency between your handwritten and the death audit report which you are sending it to the death audit committee, right? what I have observed is the handwritten slip which you are preparing in your emergency at the time of death. I know, I very well know that you are in some kind of hurry at that time, right? But I must tell you, always be legally correct, right? So to be legally correct, you need not to mention any kind of pathophysiology, any kind of academic knowledge. You are mentioning that that patient, there can be brain edema, that's why intracranial pressure is raised. We need not to have such thing mentioned in the death report, right? So the handwritten report and the audit report you are sending to us, those must be having consistency. There must not be any discrepancy, right? If you are mentioning something in your handwritten report and you are going beyond that in your death report, unnecessarily explaining those things, that how it can be happened, that pathology and physiology part, and the how it can happen, we need not to mention those. Just mention only those things which are written in your handwritten report, and try to be precise with your handwritten report, that you just make a one chart. We will be providing you with performa, right? So that you don't forget to mention things. Once you will go through that performa, you will be used to that. You won't miss anything in your death reports, right? So regarding the final certification, we need to issue the MCCD if the cause of death is clear, right? It can be known, natural, or supported by the medical evidence. In case you have labeled the case as MLC, or you have handed over the body to the police, right? We need not to issue any kind of MCCD. MCCD is medical certification for cause of death. And in that case, we will direct the relatives also to obtain the postmortem report from the police, right? We need to direct the relatives. Now, your final death report must be legible, must be fact-based, and it must be free of any speculations. That speculations like that it can be brain edema, which have lead to intracranial pressure. It can be heart attack, right? So it must be free of all those speculation, and it must be clear on the medical conclusion only, right? So right. So record keeping is very important in this audit. Maintain the death registered with all the relevant details, and the file the death audit report, including cause of death, manner of death, any findings from the police inquest, whether the MCCD was issued or not, whether it is issued by you or whether it is issued at the CSC Katra, you have to mention in that, and match all the details in the handwritten entries as well as in the audit submission. So this is the performa we have prepared for you all, and I think it will be, I don't know whether it has already been sent to you or not, but it will be finally sent to you regarding the along with the guidelines. It is a part of guideline only. This is a performa in which there is mentioned under heading that you won't miss any kind of detail regarding the in the preparation of the death reports, right? So you have to go through this performa, and accordingly you will mention the details in your handwritten death note also, right? So we need to work retrospectively. First, you go through this death report performa, and in case some death case reports to your medical unit, you can go through this performa and mention all the necessary details or all the relevant details according to this performa in your handwritten death note also, right? So this is a performa for preparation of death report, and this performa you will be sending in the death report to the death audit committee, right? So final note for all the medical officers is always prioritize the accurate documentation, timely legal intimation, and ethical reporting. Till now, maybe due to lack of knowledge or maybe due to lack of experience, I believe the reporting was not ethical. But with time, I believe uh, the changes which first lecture have brought, I believe with time we will improve a lot, right? I have a lot of expectation from you all. And any discrepancy may lead to legal complication or any kind of disciplinary action, right? So neutrality is essential on your part. We need not to be sympathetic, right? We need to be empathetic with the patient. We need not to be biased that the patient relatives are in hurry or they have lost someone and we can't be sympathetic with them. We just need to be empathetic and legally correct, right? So these are the important legal provisions. You can read them in your free time regarding the police inquest, which comes under 174 CRPC. Now it is 194 BNSS, 39 BNSS, which obligates every person to provide information about certain crimes to the nearest magistrate or the police officer. Another one is 20 BNS. It was previously 201 IPC, and it tells about the public servant framing incorrect documents or the electronic record, and the punishment for this is minimum of 6 months, extendable up to 2 years of imprisonment along with fine. Another provision important for medical officers is 106 BNS regarding the medical negligence, right? So these were some of my references. So any kind of question from any one of you is most welcome. We are open for discussion. You can unmute yourself and you can ask the question, please. And kindly raise your hand in case you want to ask any question. हाँ जी, डॉक्टर अनुराग, प्लीज.
सर, इन प्रीवियस लेक्चर आपने बोला है कि वो एंजाइम टेस्ट करके तो हम वो कॉज ऑफ डेथ दे सकते हैं, तो इसमें भी वेट करना है इंक्वेस्ट का?
कौन सा टेस्ट करके?
एंजाइम टेस्ट बोला है ना, ट्रॉप्टी.
हाँ, in this report we have recommended the Shrine Board regarding to introduce the kits for that TROP-T and the cardiac markers under the guidance of Dr. Yashpal Sharma sir. We will try to provide those kits if possible. In case those are the form of medical documents or the investigations which must be recorded, and in case those say that it is a form of or the diagnosis is established that it is a myocardial infarction and there is enough evidence on your part to believe that the death is natural, you can directly declare the cause of death then and there only. And in that case, as the death is natural, as the cause of death has been established, you need not to refer the case to police, right?
Okay.
Hanji. Any other questions from any one of you, please?
डॉक्टर जसपिंदर 90% डेथ्स जो है पोस्टमार्टम होता नहीं है उनका, तो फिर कैसे करेंगे कॉज ऑफ डेथ?
मैम, मैंने जैसे आपको बताया कि 99% केसेस में पोस्टमार्टम फॉरगो हो रहा है, एंड दैट इज ऑन द पार्ट ऑफ पुलिस दैट दे एस्टेब्लिश द मैनर ऑफ डेथ, that manner is natural, and in that case they forgo the postmortem examination. Patient was brought dead to you, you have referred as per the guidelines to the police, you have directed the police for police inquest report, and in police inquest report they have found that manner is natural and no postmortem has been conducted. So in this case cause of death has not been established. आपने पुलिस को डायरेक्ट किया था,
कॉज ऑफ डेथ इज नॉट एसर्टेन्ड है ना?
हाँ जी, हाँ जी, हाँ जी मैम. इस
ठीक,
केस में आप पुलिस इंक्वेस्ट रिपोर्ट मंगवाएंगे और उसके अकॉर्डिंग मैनर ऑफ डेथ नेचुरल डिक्लेयर करके द कॉज ऑफ डेथ कैन नॉट बी असर्टेन्ड इवन आफ्टर द रिसीप्ट ऑफ पुलिस इंक्वेस्ट रिपोर्ट. So we can simply write undetermined. Yes, the cause of death will be undetermined even after the receipt of police inquest report. The manner of death as per the police inquest report is natural.
ओके सर।
हाँ जी, एनी अदर क्वेश्चन प्लीज।